Good afternoon, everybody. My name is Janan Jensen, and I'm the Executive Director of the Health and Environment Alliance, also known as HEAL. And it's my pleasure to welcome you here today to a very special webinar that HEAL is organizing on the occasion of the release of a new book by renowned epidemiologist Dr. Shanna Swan called Countdown: How Our Modern World is Threatening Sperm Counts, Altering Male and Female Reproductive Development, and Imperiling the Future of the Human Race. During today's online event, you will get to meet the author, Dr. Swan, and hear firsthand about some of the findings in her book, which brings together more than 25 years of research on the association between exposure to environmental pollutants and health effects, and how chemicals in our environment are disrupting our hormonal balance and causing varying degrees of reproductive havoc. She is calling for more protective public health policies, and the EU's chemical strategy for sustainability, if implemented quickly and ambitiously, can provide some hope in urgently reducing our everyday exposure to endocrine disrupting chemicals. We will first hear from Dr. Swan and then be joined in a moderated panel featuring two top-notch European experts. First, we have Dr. Marjorie van Dersen, who is a professor of toxicology at the Free University of Amsterdam and the coordinator of one of Europe's leading research projects called Freya to upgrade testing methods and develop new test methods on EDCs toxic to female reproduction. And our second guest is Dr. Lolo Gomez Roya, who heads up the obstetrics and gynecological department at the Hospital Saint Joan de Dieu at the University of Barcelona. And she's a member of the International Federation of Gynecologists and Obstetricians called FIGO, where she sits and actively participates in the FIGO Committee on Reproductive, Developmental, and Environmental Health. So a few housekeeping rules for the ease of our event. We've started recording this webinar, and it will be shared with you in the next days and also available on our website. Please post your questions to our panelists and speakers in the question and answer box. We will put your questions before them in the question and answer session, which will be at the end of the webinar. You can also use the question and answer box for any technical questions you might have, or you can contact the HEAL team directly by contacting Yvonne at env-health.org. At HEAL, we are really honored to have Dr. Swan with us here today, with whom we and myself personally have worked with for over a decade, including in the European Parliament. And we're really inspired by her dedication to translating the science for public consumption and regulatory action before it is too late. It is really great to have you here with us today, Dr. Swan, and we want to welcome you very heartily on this online event. So welcome, and the floor is yours.
Wow, okay. Thank you.
Yes.
I'm so happy to be here. I'm excited about this event, having the opportunity to come back and talk to HEAL and talk to you all. And yeah, so let's get started. Share my screen and go to the right view, right? Slideshow view. Okay. And put this out of the way. Great. All right, so let's get started. So here's the book that I published together with my co-author, Stacy Colino. And as you can see, the subtitle is kind of dramatic: How Our Modern World is Threatening Sperm Counts, Altering Male and Female Reproductive Development, and Imperiling the Future of the Human Race. Can that be true? Well, let's take a look. First, I'm going to start by giving you the roadmap. If I can click to, yes, giving you the roadmap that I'm going to follow in this brief presentation. So I'm going to talk about the problem that I see that we're facing and its causes, consequences, and solutions. Let's start with the problem. So I think the problem came to our attention in 1992, which is more than 25 years ago. And this was a paper that was published by a group in University of Copenhagen. And it claimed that there was a genuine decline in semen quality over the past 50 years. By the way, the size of those yellow ovals represent the size of the populations. And that's the best fitting line between them. And the data go from 1938, actually, I think, to 91, with most of the data after 1970. Okay, so when I first saw this paper, I was asked to comment on it for a committee that I was on, National Academy of Sciences Committee. And I have to tell you, I was skeptical. It didn't seem very impressive to me. And I was hearing about all kinds of biases and confounders, which of course, some of which I thought of myself, that might explain this decline. So I took 6 months to analyze these data using the 61 underlying studies and considering all those biases and confounders. And the surprising thing was, when I was all done, the slope of this red line had not changed at all. And that was kind of amazing and made me feel like, well, maybe this is true. And I started to look more deeply into this, and this became a focus of my work for 25 years. This culminated in the publication of a very large meta-analysis. But before I show that to you, I want to tell you that when I entered this project in 95, I think it was, I asked Neil Skekebek at the University of Copenhagen, how were these studies selected? How were the 61 underlying studies selected? And he sent me a printout, actual physical paper that had come out of the computer the way they did at that time, in a big box, expressed from Europe to me. And I could see Elizabeth Carlson's notes on what she commented on each of those studies. Well, when we did this in recent years, we did something quite different. We had a very systematic search. We had a reference librarian who followed all the protocols for a meta-analysis. And we had a team of 7 people that worked on this for 2 years. This was a huge study, a very, very large meta-analysis. And surprisingly, if you look at this decline in Western countries, and by the way, the first study was primarily Western countries as well, we see that the slope is pretty much the same. So this was really interesting and alarming because it looked like this was very stable. And when we looked at it in recent years, it didn't look like it was declining. And by the way, this is not the curve that was published. The curve that was published stopped at 2011, but collaborators of mine have extended it hypothetically and asked when would it hit 0? And the answer is in 2045. These are medians. That means that the median sperm count concentration would be 0 in 2045, unless we can do something to improve the situation. And that's what we're going to talk about today. Okay, now sperm counts are important, but they're only one measure of semen quality. There's others, the shape, the motility, the chromosomal damage that's been done. And of course, there are other male endpoints. And there are, of course, female endpoints. So reproductive health is much bigger than sperm concentration. Let's look at this briefly. So there are the male endpoints on the left, and we've got sperm count on the top because we started with that, but there are many others that are correlated with this. And that's interesting because they are all correlated. And in females, there are a whole rash of endpoints, which my panelists will probably be saying something about. But what Countdown does is talk about all of these endpoints. And in addition to the male and female, there's some they share. So for example, infertility is of course a joint venture. Both can have ambiguous genitalia, hormonal abnormalities, and so on. So I just want to point out that while I focused on sperm count to begin, and it was the kickoff for this book, it is not by any means the sole subject of this book. And what's remarkable about these different endpoints is that they are declining or becoming worse at a comparable rate. So if you look at these curves, sperm concentration in Western countries, worldwide birth rates, which are surprisingly declining also 50% in that time frame, 1960 to 2020, at the rate of 1% per year. And we have less information on miscarriage rates. The study I found was limited to US and a shorter time period, but it's also increasing at 1% per year. The fact that these are marching in lockstep, if you will, indicates that they share etiology, and one predicts the other. So if one went up, the other one should go up, and that's what we see happening. Okay, so what could be causing this dramatic decline in reproductive health, at least in Western countries? So we can separate causes into broad categories first. Genetics is, of course, important, but the changes we're seeing are occurring in 2 generations, and dramatic changes of this kind in 2 generations are unlikely to be caused by genetics. So that leaves environment, and within environment, in the book, we talk about lifestyle factors and chemical exposures. But for you today, because of the focus of HEAL, I'm going to focus on chemical exposures, and in particular, on chemicals that have the ability to alter our hormonal systems, that is the endocrine disrupting chemicals. And those that I have particularly focused on are those that can affect reproduction, and that's particularly the steroid hormones, those that interfere with steroid hormone production or transmission, or in other ways interfere with steroid hormone measurements and effect. And those would be the phthalates and the bisphenols primarily, although others do as well. Okay, so why is testosterone so important? Well, testosterone is absolutely critical for the differentiation of the sex organs in early pregnancy. And this is very rough schematic, but on the left, you see the undifferentiated sex organs. And then in the presence of testosterone, you see the development of the genetically typical male. Without testosterone, that male is not masculinized. So this is a really critical part of the story. And we are focusing by looking at phthalates at chemicals that have the ability to interfere with the presence, the amount, and the timing of testosterone in fetal development. The timing of this story is absolutely critical. Let me show you why. Here are 2 graphs, and I'll give you a minute to sort of absorb them. On the left, we see the testosterone production in the fetus or in the body of a rat who is not exposed to phthalates. And then and you see that there's a peak, and that peak is specifically timed to be between days 18 and 22. But when the mom is exposed to phthalates, and in this study, it was diethylhexylphthalate, perhaps the strongest anti-androgen or testosterone lowering phthalate, the peak is completely obliterated, so that the testosterone is not available for the masculinization of the male genital tract. This is absolutely key to this story. And in addition to lowering testosterone, there is a class of endpoints which together have been called the phthalate syndrome. This is interesting because there's not too many chemicals that have a syndrome associated with them, are there? Fetal alcohol is one, but I don't know of any others actually. And in this syndrome, the male rat offspring of a mother who is exposed to diethylhexylphthalate has a smaller penis, a malformed penis, more likely to have undescended testicles, and a shortened anogenital distance, which is a measure of the size of the perineum. So when I learned about this, and I learned about the widespread exposure of populations to these phthalates, I wondered, could this be happening in humans? So I asked, are the urinary phthalate metabolite levels in a mother, pregnant, I should say, a pregnant woman, related to these measures in her offspring. In other words, could there be an analog of the phthalate syndrome in humans? And many of you may know that I spent about 20 years answering this question, first in one study in which I had stored urine, and then another study specifically designed to address this question. And by the way, it's pretty unusual in my experience for us epidemiologists to be able to get the funding to replicate their own study. And I think the fact that we got that funding is testament to the importance of this finding, which was that there was indeed confirmation of the hypothesis that early exposure to phthalates did result in the phthalate syndrome in humans. So what I show here is the two studies. The first one was published in 2005 and was made quite an impact and actually influenced regulation, like the Consumer Protection Act of 2008. And then we replicated that and published that in 2015. Other studies have since shown that in other populations. So in summary of this piece of the presentation, phthalates have been shown to be endocrine disruptors. The phthalate syndrome has been demonstrated in human males, and AGD turns out to be a pretty important marker of fetal testosterone exposure, which we can use for other evaluation of other chemicals as well. Okay, so what are the consequences of this harm that's been done? First of all, we have to remember that it doesn't stop with the exposed mother or her child, that the germ cells for the next generation are sitting, waiting, and being exposed within the fetus, within the mother. And other studies have shown that this influence can persist in multiple subsequent generations, in animals as far as 7. I think in humans we've gone to 4, but I think we have to keep in mind that when we expose ourselves, we are exposing our future offspring. I don't have a slide about this, but I want to say that we also know that males and females who have impaired reproductive function have impacts on their own health and longevity, such as higher heart disease, diabetes, reproductive cancers, early mortality. So it's not really just about reproduction, it's about overall health. And finally, I want to point out that we're not alone on this planet, and the same harms that we are causing in ourselves and our offspring, we are causing in multiple species around the world. And I'm sure you're all frightened about this as I am, and the actions that we take to limit our exposure will limit their exposure as well. So finally, I want to talk about some solutions before we open this up to questions. So the first thing I want to just point out is that most of these chemicals are not tested. Only a small fraction of the chemicals in commerce and in our bodies have ever been tested. And so this is a bleak picture, but it's to illustrate that we are in fact the subjects in a massive experiment. We're participating without our consent, and this has to stop if we're going to prevent the reproductive damage that is already happening. I want to share this wonderful infographic from HEAL and point out that it's not just high doses. Very small doses of these chemicals have dramatic harmful effects on reproduction and other function. Other functions are shown here. And in some instances, low doses actually appear to be more harmful than the higher doses, paradoxically, but that's what our data are showing. So I have 3 messages, takeaways that we can discuss. I think the first thing we have to do is to remove the chemicals that are hormonally active. We must stop exposure to hormonally active chemicals or endocrine disrupting chemicals. We have to remove the chemicals that cause harm at low doses. It's easy for them to escape detection under present regulatory systems, and they are doing tremendous harm to not only our reproductive system, but our health. We have to remove the chemicals that are environmentally persistent, which are harming not only ourselves, but other wildlife species and coming back in subsequent generations to do harm. And we have to stop exposing ourselves to untested chemicals. The big lift here is that the chemicals that are in commerce will have to be, many of them, replaced. I believe this is possible. It is already, for some groups, a program that they're embarked on, which I applaud. It is essential that the chemicals in commerce do not have endocrine disrupting effects. So that takes a huge overhaul that's starting to take place now. These chemicals have to be free of low dose adverse effects and be minimally persistent. And perhaps most importantly, they have to be shown safe prior to marketing, which is not the case in the United States, although you're doing much better in Europe on this one. And that will prevent this terrible practice of regrettable substitution, by which people can buy a bottle that says BPA free and unwittingly be exposed to BPA-F or BPA-S, which can do the same harm. And so finally, I think we have to overhaul our regulatory system, which many people on this call are working on and which I applaud. We have to look at low dose effects. We have to look at mixtures. And let me just point out, if you go to the doctor, you ask, your doctor wants to give you a prescription, she will say to you, what other drugs are you taking? And that's because interactions matter. And we are exposed to multiple chemicals, and we have to look at those interactions. We have to look at the persistence of these environmental chemicals, and we have to, of course, evaluate the risks of the untested chemicals. So I'm going to stop there and thank you for listening, and remind you that you can buy Countdown if you want. We're asking people, if you can, to use the hashtag #CountMeIn, because in this way we're hoping to generate interest not only in the book, but in the campaign that we're starting to launch to educate people and to make changes that are necessary. Thank you.
Thank you very much, Shanna. Count me in. It was excellent presentation, and just so many takeaways there. And I'm really excited now that we get into the next part of the webinar. And I'm going to hand over the floor to my colleague Natasha Sanjati, who's the Senior Policy Officer at HEAL. She's going to moderate, and I will give her the floor. And I'd like to ask the speakers to also turn on their videos, Marjorie and Lola.
Thank you, Jenon, and thank you all for being here this afternoon. Thank you very much, Dr. Swan, for this thought-provoking presentation. Before we start getting into the questions, the individual ones, I would like to turn to our guest speakers and ask for a reaction on this presentation that you just gave. Maybe I will ask first Marjorie van Deursen. You're a toxicologist, you're a professor at the Free University of Amsterdam, and as Jenon introduced, you are currently involved in developing improved and hopefully new test methods for endocrine disrupting chemicals. I would like to ask you how this presentation resonates with your work and how it resonates with what you actually see in your lab in Amsterdam here in Europe.
Well, thank you. Thank you for the opportunity to be here. And thank you, Dr. Swan, for writing this incredible book. I must say, even after working in this field already for quite some time, it's still overwhelming to see this all compiled into one story, I must say. I'm really happy to also address the male and the female reproduction, well, as separate entities, but also as a joint indication that something's wrong. Of course, you need this both male and female reproductive capacity to conceive and to have a healthy baby. But also from what we see also within the European project, Freya, which is focused really on female reproduction, is that we also know that there's a lot we don't know yet, especially when it comes to female reproduction. And I think that's also something that you pointed out on several occasions in the book. That, of course, for males, I think the research has been going on for quite some time already, and it's maybe easier because sperm is, of course, easier to obtain than eggs or oocytes. So in that respect, I'm really happy that you also focus a lot on female reproduction and the issues that are there. And especially our project is also focused on improving test methods. And I think that's definitely something where we have a lot to gain in this respect.
Thank you very much, Dr. Van Deursen. I will turn to Dr. Gomez-Roig. You are an obgyn practicing in Barcelona. You're also involved in important research involving big epidemiological cohorts in Spain and elsewhere in Europe. And you're an active representative of the International Federation of Gynecologists and Obstetricians, the FIGO, for Europe. So I would also like to ask you how those findings resonate with your work and with what you see actually in the hospital every day in accompanying families and women.
Hello everyone. Firstly, I'd like to thank Health and Environment Alliance for inviting me to this webinar, and sure, Shanna, for sharing with us your great knowledge about this subject. There is strong evidence about the harmful effect of environmental exposure, such as chemicals and air, water, soil contaminations on health. As Shanna shared with us, there are influence on sexual and reproductive health in teen girls, because disease can influence premature adrenarche, hyperandrogenic and hyperinsulinemic environments, and ovulations and subsequent polycystic ovarian syndrome, but also in pregnancy complications, increasing the risk of preterm birth and fetal growth restrictions and stillbirth too, and adverse neonatal outcomes affected by this exposure, including the neurodevelopment delay, autism spectrum disorders, and cardiac defects, among others. It's because of all this that FIGO, the International Federation of Gynecologists and Obstetrics, has a special committee for reproductive and environmental health. The members of this committee, including myself, are scientists and healthcare providers, and we work in education, advocacy, and research because we know that they are essential to increase awareness of environmental impact on reproductive health. We identify medical training opportunities to incorporate environmental health into all levels of training, and we also collaborate with World Health Organization, United Nations, endocrine societies, and other international organizations. And on the other hand, from my point of view of obgyn clinicians, I think that we should be able to share with all women and their families important tips and advice, because information we provide about chemicals exposure is essential for preventing many health problems. It's about the air we breathe, the water we drink, the food we eat, and the care products we use. We collaborate in a lot of cohorts, international cohorts in research areas, with Martin, who is connected, I saw her, and Maria Ascone, an athlete project, international project, and in this cohort. And I think that all this is really very important. Just to finish my interventions, to share two sentences from FIGO committee. First, women need to make healthy choices for their lives, their families' lives, and for future generations. And society needs to ensure that healthy choices are possible. Thank you.
Thank you very much, Dr. Gomez. And I'm actually triggered by some things that you just mentioned in your intervention, and that Dr. Swan touches upon in her book. This is this issue of the ripple effects of those reproductive health disorders that carry long-term consequences for health of both males and females. I was wondering if both you, Dr. Van Dusen, or Dr. Swan wanted to react maybe on both aspects of how much are we, in terms of research today, able to make links between some of the effects that we search for instance, when studying EDCs and those long-term effects? And maybe Dr. Swan, maybe also some thoughts from yourself on what does that trigger for you in terms of prevention needs, those ripple effects, and how do you see that in the context of political discussions and education for patients? I don't know if both of you want to come in with maybe different aspects of the spectrum.
Well, let me just, because my two panelists are working with women, I'm going to say something about the men. I have to represent the men here, right? About the male sperm count. Most men don't know that, don't know their own sperm count, right? They don't until they going to need it because they don't know how to know it. And in fact, that's very short-sighted because it is now in multiple studies, quite strong evidence that it's linked to later health and actually longevity. So, and I don't know if any of you were part of the call to make reproductive health a sixth vital sign. You're aware of if you weren't even participating in that committee, but a committee came forward and said that reproductive health should be the sixth vital sign because of its ability to, tell us something about people's future health. And I think the evidence for this is now quite strong. It's much stronger for men than for women. It's hard because you can count the sperm, but you can't count the eggs very easily, right? And so, where you can look at markers, where maybe you could talk about some of the markers of altered female reproductive health, which might predict later disease.
Well, I think that's something that we're still looking for a sensitive marker, because at this point you just count eggs and that doesn't tell you anything about the quality of the eggs, more or less. So, and I think that's also one of the issues with the way chemicals are tested currently. I mean, if you look at the most extensive assay or test guideline that's out there, it still was not designed to pick up endocrine disrupting effects. So there are endpoints that might be predictive of it, but it was not specifically designed to pick up these effects. So I think there's a lot to gain. So one of our partners in the Freya project just published a paper showing that even for diethylstilbestrol, which we all know causes reproductive effects also in the offspring and also in multiple generations, that the current test guidelines are just not sensitive enough to pick up effects of this chemical. And then, well, that makes you wonder, what are we looking at? So maybe we're just not looking at the right endpoints. And I think that's definitely something of concern, I would say.
Thank you, Dr. Van Dusen. And in fact, this leads me to my next question to you, because you're involved very much in regulatory toxicology. And I was wondering, to what extent do you think that the new chemical strategy for sustainability that was released in Europe in October can be a game changer in delivering Europe's promises to improve this regulation of endocrine disruptors?
Well, I think it's really promising that at least there is a chemical strategy, let's put it that way. And definitely that also endocrine disruptors are mentioned specifically. So it's clearly on the agenda and people are clearly getting more familiar with the concept. On the other hand, I must say we have been working on this and science has been studying endocrine disruption already for decades now. So it's quite worrisome that we still are at this point, that people are still asking, okay, but we don't see any effects, and what are the effects? And well, if you read Dr. Swan's book, I think it's compelling and it's clear that there is an effect. So that's a bit of the difficulty, I would say. I think one of the things that would make the chemical strategy even better if there are specific also steps in which to follow. So what will happen now actually? So how is it going to be implemented? And it should not be used to delay things further. So go for impact assessment. So which means that it takes even longer before actual steps are going to be taken. So I think it's promising, but definitely it still needs some fine tuning on what can be done and what will be done also on the short term, and not only looking at the long term issues.
Yeah, thank you very much for this. And I see in the chat that we got a question from the coordinator of a project called Protected In, Lisa Connolly, who asked actually, because she confirmed that there are many effects with mixtures modeled on human exposure and at very low level concentrations, which complicates the problem even more. Do you think that it is possible for legislators to take the low level mixture risk on board? And I think that's a bit what you just touched upon. Whether it's possible, I think it is. Whether we are ready to get that included in legislation is probably the other challenge, I would say.
Well, if we still keep adhering to the traditional toxicological paradigm, more or less, or the way we do risk assessment, I think we will never move forward. So we need to look at mixtures. We need to look at transgenerational or multi-generational effects, early life exposure, late in life effects. And I think all of these issues are not very well addressed in the current testing guidelines and the way we are dealing with chemicals at this point. So in that respect, science is much further ahead than the regulatory decision-making, I would say.
Yeah. Dr. Gomez, you are, as we said, a clinician. You're seeing patients every day, families, women, and you are very involved in the reproductive developmental health committee of the FIGO. Do you have specific demands for decision makers when it comes to prevention policy? Are there specific things that you would like to see from your clinician's perspective when talking about risks coming from EDCs?
Yes, first I'd like to comment that from clinician's point of view, it's a little bit difficult because not all healthcare providers are trained or are informed about toxics and contaminants that could influence in women's health. So I think that the most important thing is to share all the knowledge that we have with all the health providers that are attending all our women or teen girls or men, because we are focused all day working, and sometimes we don't have time to think and to take care about the real life where we live. So I understand the point of view of Shanna that the research in women is really very complicated because association is not equal causality. So we encourage at the same time to going on with research in women because we are able to isolate in different samples chemicals, endocrine disruptors, breast milk, placenta, amniotic fluid. And we know if you compare the high exposure with lower exposure, there are more preterm birth and more fetal growth restrictions, for example. But the most important thing is that are we sharing all this information with our population? And I say, not as I like, because firstly, we need to train health provider cares, midwives, clinicians, and everybody that this is important subject that we need to share with everybody, with parents, the families, with teenagers in the school, and with pregnant women and other people in other life, everybody.
Thank you very much. And in fact, this also leads me to my next question to Dr. Swan. In the prologue of your book, you have this thought-provoking sentence, which is that the sperm count decline is akin to where global warming was 40 years ago, reported upon, but denied or ignored. And further in the book, I think you rightly mentioned the image of a canary in a coal mine scenario. And I think this is exactly pointing to where Dr. Gomez was just bringing us. Can you tell us a little bit more about the use of these analogies and their implications in terms of planetary health, really?
Thank you, Natasha. I ask myself, why is this message not heard very well? And I see what's happened in our view of global warming. And so here's the analogy that I see. When the Carlson paper came out in '92, it was denied. it was denied that sperm count had declined. I myself denied it until I studied it, but most people didn't study it, they just denied it. And that's what happened with global warming initially. And then with global warming, as people started to see the impacts in their daily lives of temperature change and fires and floods and so on and so forth, then they could no longer deny it. And they said, well, yes, it's happening, but humans have not caused this. That was sort of the next step, right? And I think that's where we are now with sperm decline. I think the 2017 paper, I know the reception was very, very different from the 1992 paper. People did not deny sperm count decline after this paper, but they said, it's just happening from other reasons. It's people are smoking, they're stressed, they're this, they're that. It's nothing to do with chemicals. And so I think what we need to do is now take the next step to recognize the role that we're playing in this, the role that the chemical establishment, if you will, is playing into this decline. And just as we're starting to recognize in global warming that we are playing a role and can do something about it. And that's what it's going to take. Yeah.
Thank you very much. And we, in fact, have another question coming from Ireland, which is asking if it would help if organizations like cancer support groups, infertility groups, breast cancer groups campaign more to educate our healthcare providers. I don't know if any of the three of you have thoughts on this, which
I think the healthcare providers should answer that.
But do you have any examples, positive examples to share? I don't know if any of your countries where you have seen steps of healthcare providers getting involved and positive experiences showing that this can really help getting patients and different stakeholders on board in terms of prevention.
Yes, in Barcelona, we work together with the primary care assistants that include all health and reproductive health of women. And we try to share training with midwives. They usually go to have a special training in how to visit women in order to avoid to live pregnancy with best lifestyle habits and trying to avoid the consumption, for example, of alcohol, tobacco, and giving tips and advice about how to avoid chemicals in food or in other issues. But we try to train in coordination with hospitals and research teams, midwives, because we think that are very important healthcare providers in our society.
Thank you very much for that. Another question we just received is the following: how to expose the chemical burden of mankind without threatening breastfeeding if breast milk is used for the analysis of chemicals in our bodies? I'm not sure if any of you wants to say something about that. I wonder if the verb was not to reduce the chemical burden of mankind. Maybe that was more the question that was to be asked. But maybe any of you wants to react on the chemical burden that is passed through breast milk, maybe? Is that something you would like to comment on?
Well, it's clear that breast milk contains chemicals, that's true, but generally it's still believed and maybe also shown that providing breast milk is still the healthy option, especially for early life development. So that's not something I would discourage, but it's definitely something that we need to consider as an important route of exposure if we are thinking about exposure of young children and long life exposure. So things that can happen during development and can also be amplified or aggravated during life because of additional exposures during life. So I think it's an important route of exposure and that we need to consider it. but I would not discourage breastfeeding at this point, definitely not. But and that's why also I agree with Dr. Lola that it's important to provide a good information also to for midwives and also pregnant women. But I would really like to stress it's really a societal issue, that it's really something that also addresses the male and also the non-pregnant woman and the children in society. So it's definitely an important group that we should focus on. So especially young children, which are very susceptible for these types of effects. But it's definitely also exposures during one's lifetime that makes a difference. So it's I would strongly be in favor of taking a more broader approach here and tackling it as a society as a whole.
Yes, I think you're rightly pointing to the fact that we're in fact facing a societal challenge, which raises political questions, and in fact makes me turn to you, Dr. Swan, again. As we went through our archives when your book was being released, we realized that you came to Brussels in 2012. That is almost 10 years ago. You were in the European Parliament addressing European decision makers on the topics of endocrine disruptors. And that triggered this question in my mind of whether any of the messages that you delivered back then has changed by now, and if so, in such a way, in which way?
Gosh. Yeah, you like to hope you did some good, right? I think the fact that, well, first of all, I think legislation in the EU has improved. I'm not, unfortunately, up on the details of that, so I can't. And I hope you, maybe the rest of you, could fill us in on that. But I would say I think awareness has increased. Awareness of the problem has increased, and I think the concern for this has increased. But it's slow. I mean, I'm remembering, the story of asbestos, or the story of cigarette smoke, where 1964, cigarette smoke was declared a human carcinogen, right, by the Inspector General of the United States. I mean, my gosh, that was what, 60 years ago, and and asbestos is still not illegal in the United States. So 10 years is a long time. But it's not a long time for changing patterns of use. Yeah, maybe someone else can comment on. I'd love to hear some great things that have happened after I spoke.
Thank you. I think the point you're making is pointing towards something that Mayuri raised earlier on, which is that there is lots of research, and in many ways science in Europe is ahead of the political processes. Right. Lots of publications are being released every year pointing to concerns about endocrine disrupting properties of many chemicals. The problem is that the regulatory framework does not always allow to qualify them as endocrine disruptors. And in the discussions that are taking place in Europe right now, I think among the environmental health community, that is the big concern, that we are making progress in identifying some chemicals. We have about a good dozen identified under REACH, but the real concern is about the thousands suspected that are not being taken care of in terms of political action right now. And that will be the big challenge under this chemicals strategy for sustainability, getting a hazard classes for suspected endocrine disruptors. And that is something that will for sure keep us busy in the next 2 years. But maybe coming back to something very pragmatic, because I see that time is running, I would like to maybe finish this conversation by turning to the three of you and asking if maybe you do have advice to share with participants on how you would go about reducing your exposure to endocrine disruptors and other harmful chemicals, because this is a question that we often get, and I think it's pretty exceptional that we can get 3 different perspectives from this very important work that is being done in the same panel. So maybe you would like to conclude with a few words on that.
Well, I can start and just say, first of all, we have 2 chapters in the book about reducing exposure. And I'd like to just mention that this is not a panel on lifestyle behaviors, but these are also important for the kinds of outcomes we're talking about. And we talk about those in the book. As far as chemical exposures, my first suggestion is that to the extent possible, we eat unprocessed food. Because the processing of food is how a lot of these chemicals get into our foods. If possible, to eat organic foods, which is an economic challenge for some people, especially in the United States. And then to swap out, whenever possible, glass or ceramic for any plastic containers for storage, and of course for heating. We never heat in plastic, right? So foods, I think taking care of what we're getting through our food is big. That's the major source of many of these exposures. And water is, of course, a concern. We're increasingly learning that even the so-called safe plastic bottles are not maybe that safe, and a good filter or perhaps distillation might be in order. That's what I do in my house, by the way. We distill our water. It tastes very good, and it's very, very clean. And then a very simple thing is that you don't want to hang anything in your car or in your house that makes it smell good. So, there are other ways to deal with smells, but be really careful of fragrance products. And we had in our study, and many studies have done this, where you ask people what did they do in the past 24 hours, what did they use, what products, and so on and so forth. And then you see this correlation with measure levels in the urine of it. So I think taking care of the products we put on our skin, and of course sunscreen and cleansers and laundry detergents and all these things. So there are many resources, and again in the book we have a page of resources, but many groups have resources on their websites where you can go and you can put in a particular product and see how safe it is. So I think what this takes is that you admit this is a problem. This is something you're concerned about. That's the important first step. Once you make that step, then you can find solutions, but most people don't make that step.
Thank you so much for this. That's also a very positive note to finish on. I don't know, Mayuri or Dolores, if you want to add on that?
Mayuri.
Well, I don't have a lot to add, I must say. I think indeed you give very specific pointers to how you can avoid these types of chemicals. So I think that's really great. And I think what people maybe also do not realize is, even though maybe the PFAS in your non-sticky pan may not be very harmful for you as a person or an individual, the entire production chain and processes that are before that can be very cause a lot of pollution. So I think it's you make these choices not only for yourself, but also for the demand of these types of chemicals, and also for the entire production chain. So I think that's also something I would like to stress here as well. It's also important to realize that it makes a difference if you make these types of choices in your life.
Thank you.
Yes, and just to summarize, because I completely agree with all the advice. I think that therefore it's important to take action to improve knowledge about harmful exposures, translate science into action, and alter global behavior of governments, industries, and people. We think that creating a global strategy is essential in order to advocate for policies to prevent exposure to toxic environmental chemicals, work to ensure a healthy food system for everybody, make environmental health part of healthcare, and at the end, champions environmental justice. I think that is a little bit summarized of everything.
Thank you very much. Thank you very much, all three of you, and thank you all for participating. I will now hand it over to Jinon to close this session.
Yes, thank you, Natasha, for your excellent moderation, and to all the speakers. Really, really good information. Very good tips at the end, but also some really good ideas and challenges you've brought out. I would like to thank all of our listeners on this webinar for your time, and we will be putting this webinar online in the coming days. If you would like to listen to it again or share with any of your colleagues, we hope. And Dr. Swan, we really wish you a lot of luck. And I have one last question for you, is will this book be available in other languages before we leave? Because we have listeners from all over Europe here, and we're hoping that maybe we could have it in other languages.
Yes, I hope it will be in tons of languages, of course. Right now, we have only sold Scribner has sold the rights for German and Chinese editions, which is a little surprising. We're starting to talk to some French publishers, and hopefully we'll move into other countries. And then, of course, the question is, even in English, when is it going to be released, right? So it was released in the US February 23rd, in Great Britain. I believe it's early in April, and then other countries will hopefully follow. So I know it's not that easy to get it yet, but I think the Audible is always available, and the Kindle, although I'm not actually sure about that, but I think so. I think you can get the Kindle on the Audible. So anyway, you might ask for it at your bookstores. That might help. You know, we would love to buy Countdown. When are you going to get it? And maybe that would trickle down. I don't know, but I don't know the book business. My first book, so I don't know what makes people, it makes it spread across the world. But hopefully it will, and more people will hear this message. Thank you.
That's great. In the meantime, we have in the chat to find out more about the book. You can actually visit your website, www.shannaswan.countdown/ No,
actually, just www.shannaswan.com is really
okay. Great, excellent.
Just my name.
Okay. Oh, very good. So, thank you, everybody, and thank you especially, Dr. Swan, for being with us. And we will continue to look out for other work that you're doing and promoting what the important messages and action that we need to take to reverse these trends. So, thank you very much.
Thank you for having me.
Yes, it's great to see you all.
Thanks.
Okay.
Thanks all for
Thank you, Marjorie and Lolo and Natasha, and everybody have a good afternoon.
Okay.